Once IVF was introduced in the mid-70s, it became possible for women who had blocked tubes to become pregnant. This also began to be applied to couples who had unexplained infertility. But the big problem was couples where the problem was one of male infertility. The men had poor sperm counts. In these couples, it wasn't possible to do artificial insemination because the sperm quality wasn't good enough to allow the sperm to swim up through the uterine cavity into the tube and fertilize the egg. It was also found that IVF wasn't successful for these couples because even if you put the sperms just next to the eggs, they didn't have the ability to fertilize the eggs. At that time, the only option available for these couples was either adoption or for the couple to use bank sperm. Now, clearly, this is not an option, or these are not options which are acceptable to many couples, and especially in the Middle East, where Islamic law prevails, it is illegal to use donor sperm at all. So something had to be done for these couples, and that's when Icsi or ICSI was introduced. Icsi stands for intracytoplasmic sperm injection, and what we do in this procedure is what I'm going to describe to you now. Of course, before we start doing the actual Icsi procedure, we need to stimulate the woman's ovaries so that she produces a sizable number of eggs. The stimulation is very similar to what we do when we are doing IVF. The woman comes in on the second day of her menstrual cycle. We give her a series of injections over 10 to 11 days. During these injections, she has 2 or 3 scans to see how the follicles are growing. When the follicles have reached the appropriate size, the eggs are harvested as they are in standard IVF treatment. Now, this is where things begin to differ. What we do in the laboratory in Icsi is quite different from what we do in IVF. In IVF, we just put the eggs and the sperms together, and one of the sperms fertilizes the egg. Now, this is what can't happen if the sperm quality is poor. So we pick up a single normal-looking sperm in a very fine needle. Now, this needle is very, very fine. It is about 1/10 the thickness of a human hair. So you're picking up a single sperm in such a fine needle and injecting it inside a mature egg. You need to realize that the egg can't be seen with the naked eye. It is being magnified many times by a microscope. The sperm is 1/100th the size of the egg. It can never be seen with the naked eye. So the entire procedure is extremely delicate and needs to be done by a highly skilled embryologist. Once we've put the sperm inside the egg, it starts behaving like it's completely normal. It fertilizes the egg, the embryo forms, we grow the embryo for 2 or 3 days, or sometimes for 5 days if we are going in for blastocyst culture, and then transfer the embryo back into the woman's uterus. There have been some new developments in the field of Icsi as well. When we try to pick up a sperm, we want to pick up the most normal looking sperm and a sperm which is functionally capable. When we decided to pick up the most normal looking sperm, we introduced a technique called IMSI, in which the sperm is magnified about 500 times. In this way, we pick up the most morphologically normal looking sperm to inject inside the egg. Another development has been the introduction of a dish called the Pixie dish. Now, the Pixie dish has a little ring inside it, and this ring is made of a chemical called hyaluron. Hyaluron is the same chemical which coats the surface of an egg, and it is sperms which can bind to hyaluron which are more likely to be able to fertilize an egg. So by using the Pixie dish, we pick up sperms which bind to this hyaluron ring and then inject these sperms which we think are functionally more competent into the egg. We have been getting good results in Icsi by using the Pixie dish, and I expect that as new developments come in, we would be able to put back a sperm which is not only looking good but is also able to perform well and has normal chromosomes into the egg during the Icsi process. The embryos that are generated during IVF or Icsi, we could transfer them either on the second or third day of their growth, or we could grow them for 5 days till they reach the blastocyst stage. When we transfer them on day 2 or day 3, we quite often do a process called embryo hatching. This involves using a very fine laser beam, and this laser beam essentially dissolves away a small portion of the shell covering the embryo. By doing this, we make it easier for the embryo to hatch or escape from its shell and implant into the wall of the uterus.